medicine should move forward. We shouldn't be moving backward. And unfortunately, with the canceling of the mRNA contracts, the canceling of cancer funding research, children's cancer funding research as well has been cut. It's like any American, I think, would be against that.
Yeah.
You know?
He did. Didn't he get food dyes banned or something? At least.
Yeah, I mean they're tackling a number of different food dyes, and if you want to do that, great. I don't think that the health problems in the United States are caused by food dyes. A lot of these food dyes exist in Europe just under different names. I think one of the big ones people talk about is red dye 40.
Right.
It's just in a different name in Europe, and they still use it in
Oh,
a
really?
lot of their food. Yeah.
Oh wow.
So I don't think that's the source of people's problems. I think I totally love the idea of more exercise and eating clean and eating whole foods for people and focusing on their health, but taking the dye out of Cheetos is not going to solve America's health problems. So it's like whatever. If you want to do it, great. But I'm more interested in like the research surrounding cancer and stuff like that.
Yeah, they're trying to get Coca-Cola to use cane sugar, I think.
It's like what are we like? That's just it's so ridiculous. It's such a small thing to focus on when there are so many bigger issues in health. AIDS is still impacting Africa more than ever, especially because USAID has been cut. Cancer is the #1 killer in the United States when it comes to diseases. There's just so many, and there's so many amazing developments in science, so many cures that we can come up with for a lot of these things that we thought we'd never cure. And now, like RFK is focused on food dyes. It's just it drives me nuts, man.
The stats on cancer are super concerning.
Yeah.
And I know people in their 20s getting it now.
Dude, it's heartbreaking. One of the main cancers that is going up, especially for young people, is colorectal, and they believe they don't have a specific reason as to why it's going up in young people. They think it's because of diets or being exposed to certain chemicals in the air and the water. Not necessarily like for the general public, but if you live near like an oil rig, for example, you're more likely to get cancer. But it's super concerning, but it's very dull talking about the increased cancer rates. But I've actually researched this for some reason recently. There's really amazing developments aside from mRNA. They're looking at AI, for example, that can look at not mRNA vaccines. Aside from that, they're using AI to look at MRI scans.
Yeah.
And to the human eye, it can be really difficult to see a tumor that's forming because the images are just not that clear. Whereas they're using AI now to identify these things, and it has a higher rate of identification than humans.
That's awesome.
So you can catch it way earlier, and a lot of the worst cancers like pancreatic, colon, things like that are only caught in stage 3 or stage 4. Now we're looking with AI, we can do it in like stage 1, and then if you do it in stage 1, you have like a 97% 5-year survival rate. They're also looking at 3D printing organs. Really? Yeah. So if you have a cancer-infected organ, they're looking at, it's only on a very small scale right now. I think they've done ears in people, and it's obviously takes a lot of work because of organ rejection is still very much a thing and in the United States, and it's always going to be. But they're looking at like 3D printing organs, livers, lungs to, if you have one that's affected by cancer, you can get a transplant. That's still like 30 years down the line, but cool nonetheless,
How do you feel about just overall the healthcare system as is today?
I think it sucks.
Okay.
I
so
think
we agree on that.
Yeah, I think it's trash. The rate of uninsured in the United States, the rate of people who are underinsured, which is different than uninsured, of course, is brutal. And it makes me, I think so often about the families who a loved one gets cancer, horrible disease that we're talking about, and they're sitting at the hospital bed of their loved one, and they're thinking, their first thought is, how can I make sure my loved one gets better? Their first thought is, can I even pay for this? Can I afford for them to get better? And I think in the wealthiest country in the world, that's a travesty.
Agreed.
You should, if you get cancer, you shouldn't be going bankrupt. You shouldn't be going poor. You shouldn't be going hungry. You should be able to get that treatment. And it's one of the most, I think, depressing parts of politics right now that gets some conversation, but not enough.
Yeah. Well, Trump cut a lot of Medicaid, right?
Yeah, he cut a lot of Medicaid, a lot of Medicare, cut food stamps. And so there are estimates, depending on the program, but broadly, that around 16 million people, because of his big, beautiful bill, he calls it, are going to lose their health care.
Wow.
16 million. I mean, these, and the people on Medicaid and Medicare, these are hardworking folks. These are low-income Americans.
Yeah.
They're not making millions. They're not making billions like Trump's buddies. These are hardworking folks who are working blue-collar jobs. They might be out of work because of their sickness, whatever it might be. And because of Trump, and because he wants to give some tax cuts to his wealthy friends, he says, well, fuck you. You don't get health care. You don't get the care that you previously needed. These programs have saved lives, and Trump just like that. 16 million people gone. It's so sad.
Something needs to change, because even myself, and we're pretty wealthy, like I don't even want to get an ambulance. It's like $5,000.
I can't tell you how many stories I've heard of people my age who get into an accident or have like a stupid drunk fight or something like that, and they specifically, even in their drunk state, say no ambulance because it's going to cost like 10 grand.
Even while they're drunk.
Even when they're drunk, they know they're locked in.
That's nuts, dude.
Yeah, so it's terrible.
That's the state where we're at. What do you think a good alternative would be?
I mean, I'm not like in line with Bernie Sanders.
Yeah.
I think Bernie is really passionate, has like some decent ideas that we can work on. But when it comes to healthcare, I'm not like a Medicare for all guy. I wouldn't be opposed to a system like that in the future if we can get there. I like Pete Buttigieg's plan from 2020. He said his plan was a Medicare for all who want it, which is you can keep your private insurance if you want to pay for that's perfectly fine, no problem. But there should be a government option that anybody can sign up for, regardless of your wealth. And if you want to put like a wealth cap, so like a millionaire can't sign up for it, that's perfectly fine. I have no problem with that.
Yeah.
But I think there should 100% be a program of which, regardless of income status, regardless of where you are, regardless of who you are, can sign up for. And if you get into an accident, you have a terrible disease, you can go to the hospital, not worry.
Respect. You tweeted out, Trump doesn't care about stopping crime. Wherever you guys are watching this show, I would truly appreciate it if you follow or subscribe. It helps a lot with the algorithm. It helps us get bigger and better guests, and it helps us grow the team. Truly means a lot. Thank you guys for supporting, and here's the episode.